Imagine whenever you scratch your body, you have a pile of skin detached, creating big rashes all over the area. This is what a patient suffering from ichthyosis experiences every day. What is ichthyosis? Ichthyosis is a term for severe, persistent problems with dry skin that almost always start in childhood or infancy. Ichthyosis can be genetic, inherited, or can develop later in life. In a large majority of people with the disease, the cause is related to one or more genetic mutations. Under normal circumstances, the body continuously renews its skin surface, building new skin cells and allowing older cells to be shed from the surface. Ichthyosis disrupts this balance, either because too many replacement skin cells are produced or because the skin cells do not separate well from the skin surface when it is their time to drop off. The result is that skin cells accumulate into thick flakes that adhere to the body and can resemble fish scales.
When we first received Portia's diagnosis, right after she was, or soon after she was born, immediately Sean found first a foundation for ichthyosis and related skin types on the internet.
When I got mostly used to it a little, I started to get more friends, and now I have a bunch of friends.
People with this condition lose the protective barrier that keeps moisture in their skin. They also make new skin cells too quickly or shed old cells too slowly. This leads to a buildup of thick, scaly skin. Most cases of ichthyosis are mild, but it can also be really severe. Some types of ichthyosis can affect your other organs too. Unlike ordinary dry skin, ichthyosis is dry skin that results from an inherited disorder called inherited ichthyosis or from a number of other disorders or medications called acquired ichthyosis.
We know that this gene encodes a protein that's important in moving lipids and fats in skin cells. And lipids and fats in skin cells are very important for a number of things, but one reason is to form the functional skin barrier, which prevents you dehydrating, prevents you getting infections and things like that.
Inherited ichthyosis, the most common forms, are the result of genetic mutations that are usually passed on from parent to child, but that sometimes occurs spontaneously, such as a really shocking case in Saudi Arabia, which a male baby was born at 37 weeks to a 20-year-old mother. The pregnancy was uneventful and the mother had received regular prenatal care. The baby was fourth and the last child of Saudi parents, the couple being paternal first cousins.
Is your peace, Jesus, your help.
The parents had no family history of any inherited skin disorder. However, at birth, the baby was covered with armor plate-like, thick yellowish scales split by extensive, deep fissuring extending into the dermis. Any attempts at movement, for example during crying, readily caused oozing of fresh blood from the fissures. The baby was shifted to a high dependency unit at 45 days of age. He stayed in the hospital for 8 months, during which skin infection as well as other problems were treated, and to everybody's shock, he survived the fatal disease and is still being treated at the age of 7 in another hospital. Acquired ichthyosis may be caused by a number of internal disorders, such as an underactive thyroid gland, lymphoma, and AIDS. Some medications can cause acquired ichthyosis, which typically develop during adulthood. Certain genetic conditions affect other parts of the body besides the skin, including nerve damage, deafness, or loss of the sense of smell. Adults may develop ichthyosis due to certain cancers such as lymphoma. Skin dryness is usually worse in winter months and in dry climate because warmth and humidity improve these symptoms.